3.
Thank you. Good afternoon, everyone, to part 2 of our Statewide Independent Living Council quarterly meeting. Today is April 21st, and I want to welcome everyone again for part 2. Thank you. If you were here yesterday, thanks for returning. If you weren't, I'm glad you're here. Okay, let's see. Let's go ahead and take a roll call, I guess, just in case. Could you go ahead and take a roll call, Wendy? And then we'll jump right into.
Yes, this is Wendy Thornley for the record. Evander Davis.
Here.
Vicki Essner.
Present.
Mary Evilsizer.
Present.
Dee Dee Formaster.
Present.
Eric Jimenez. Jennifer Kane. Sabra McWhirter. Oh, I'm sorry, Dawn.
Jennifer is excused today.
Jennifer, okay, thank you very much. Okay, I heard Sabra McWhirter say here. Raquel O'Neill.
Raquel is also excused today.
Okay, thank you. Kate Oste.
Present.
Cheyenne Pasquale. Renee Portnell is excused. Ace Patrick.
Present.
And Julie Weissman Steinbach. And we do have quorum.
Okay, thank you. And I'm just going to go ahead, Wendy, and ask for a verification of posting.
It has been posted.
Thank you.
Water.
Move in now to
I got some True Moo.
somebody not muted here.
Half and half.
Okay, thank you. I'm going to go ahead and move into public comment, and then we'll go right into the agenda and where we left off yesterday. So I'm going to open the floor for public comment. Is there any public comment?
I do not see any hands raised.
No hands? Okay, great. Let's jump right back in. We are going to start off today with item number 9, which is a report and discussion regarding consumer trends at the Rural Center for Independent Living, RCIL. So Dee Dee Formaster, who's the executive director of RCIL, is here. So Dee Dee, you are on.
Good morning, everyone, or good afternoon, rather. Of course, our major issue in regards to things we're working on is, again, housing. Our friend that will not be going away for quite some time, I'm sure. We've been working with our consumers and people who are homeless with, unfortunately, the only housing that is now available, which is still far and few between. We have been temporarily placing people into, yes, my hated area, which is existing motel rooms, which they infer are studios, which I don't feel that a mini fridge and a microwave is really a studio apartment, but that's what they're categorized as. So we have had to put people that are under the age of 50 in these existing hotel rooms. And the people who are over the age of 60 has been a little bit easier. We do have several senior housing complexes. So it's been a little bit easier to place those people, thank the Lord. And so it's the people that are 50 and younger that we have had problems with placement. So we continue to constantly look for anything that might be open for those who are below the age of 50. So, and temporarily, I figured that they're okay in that housing for now. We have also continued to work on the Nevada vaccine collaboration that we're doing to help people with disabilities in the rural areas of our state to receive assistance to be able to get vaccinated. And we have continued to provide transportation to clinics, provide vaccination scheduling, appointment reminders, and information on boosters so that our folks can be able to get their second booster. And we have been working hard on increasing transportation routes for people with disabilities. And we met with several consumers last week that will testify at next week's important transportation meeting. So those are the three issues that we have chosen to work hard on. And of course, we're still doing advocacy in the schools and continue to reach out to provide any other needs of our consumers in our community. And that about wraps it up. Does anybody have any questions?
I do not see any hands up.
This is it. Dee Dee, do you have any numbers for us? Like how many consumers?
We're doing about 2 to 3 a day. Sometimes, you know, we're receiving a lot of calls, especially from the rural areas. We've received 5 phone calls this week from the Yerington area, 2 phone calls this week from the Fernley area for people in need of services. And we continue to reach out to our rural areas. And Linda's here with me also.
Hi. Oh, I gotta go.
Is there any questions?
Yes, this is Jackie Obregon with Nevada Medicaid. I do have a question. Are any of those transportation issues for any Medicaid recipients?
Yeah, we always have transportation issues as far as in regards to people having enough money to be able to get on the buses to appointments, but also transportation issues where there is no transportation, which is out in the rural areas.
Okay, so I don't know if you guys, if this group is aware, but Nevada Medicaid does provide transportation to medical appointments. So I can provide this that number to this group. And so if the recipient is a Medicaid recipient, all they need to do is call this number, the number that I'll provide, and then I can also put it in the chat. And just
That would be absolutely wonderful, Jackie. Thank you.
and then I'll also put in the chat our transportation inbox, which one of my staff, her name is Kelly, she mans, she works that inbox daily. And so if anybody's having if you have questions, or somebody has issues that you're having issues maybe with the vendor trying to schedule an appointment, and then maybe she can try to resolve that with the vendor, but they first have to call the vendor. So our vendor is MTM, and the number to call, it's 844-879-7341. And so we not only provide the transportation, but if an individual has somebody that can provide the transportation for them, if somebody can take them to their appointment, we can provide mileage reimbursement for that individual, to take them to that to that appointment, and they can provide that information when you call. The trick is that they have to call before the appointment, so they can't just call the day of the appointment, because that's a little hard to try to get a vendor to to pick up that ride, or for them to set up that ride. But if they call at least a couple of days before their appointment, if they know when their appointment is, of course, if it's an emergency, they need to get to the doctor today because something happened and they just happen to get an appointment today, they just have to make that call and let them know, hey, you know what, they got me in today. Is there anything you guys can do to get me to that appointment today? But they have to let that operator know, hey, they just got me in today. And so as long as they communicate that to whoever answers the phone, they should be able to assist. All they need is their Medicaid ID. And I believe they ask them for their date of birth and their address when they're calling to verify, that is who they are. And then I'll go ahead and our inbox it's pretty easy one. It's transportation at DHCFP .nv as in Nevada .gov.
That sounds great, Jackie. I just have a quick question. Do you also cover the rural areas?
Yeah, we cover the entire state. So the transportation is for in and out of state appointments. So if somebody that lives in Yankton happens to have an appointment in Vegas, because that's where their specialist is, we can set that appointment up. Or their appointment is in California or in Utah, we can set those up.
Well, how wonderful. Do you guys don't do Medicare or?
No, unfortunately not. They have to have Medicaid. If they have Medicare, Medicaid, as long as they have Medicaid, they're fine. They have to have Medicaid. Yeah.
Okay.
Yeah, this is Ace. Thanks, Jackie. And I know you're on our agenda to speak later. So thanks for giving out that information. And maybe when your agenda item comes up, you could repeat just a little bit of that again for those that are coming on late even.
Yeah, no problem. And if you guys would like to put us down on your agenda for for us to talk about transportation, we'd be more than happy to do that for the next time.
Great. We even have a work group. Our transition work group has been talking about transportation. So maybe I'll work with Dawn and we can work with you on asking you to come maybe speak to that as well. So
Perfect.
that sounds
Thank
good.
you.
Great.
Thank you very much for jumping in, Jackie. We appreciate it.
Yeah. Normally I'd only let somebody off the council jump right in like that, but since you're on our agenda, Jackie, and you had something to say, I just went ahead and allowed it.
Sorry.
No
Sorry,
worries, no
that's
worries. Thank you so much. Thank you.
Okay.
Because I know Dee Dee needed the information. So are
Okay.
there any other questions for Dee Dee?
Or information, that would be great.
Council members, anybody from the council have any questions for Dee Dee about our CIL? And Dee Dee, you're working a lot with, I know, the homeless community and the veterans that are also homeless. I know you also have a big consumer base of people with mental illness, correct?
Yes, yeah, our consumer base includes the homeless that are on the streets and in need of medical assistance as well as housing. So.
Thanks, Dee Dee. Any other
thank you so
questions?
much.
Any other questions for Dee Dee? Okay, if not,
I'm
no.
signing off for
Well,
now.
for now. Okay, so let's move on to item number 10, which is a discussion and make recommendations regarding the administration on community living's public health workforce special funding through aging and disability services. And is Cheyenne here?
Good afternoon. Ace, Cheyenne is here.
Hi, Cheyenne. Okay, this you're on.
Okay. Well, good afternoon, everyone. So I wanted to just talk briefly about public health workforce funding that was made available to ADSD through the Administration on Community Living. The agency is receiving a total of $391,000 that will be available to us through September of 2024. And when we first found out about this funding, we started doing some brainstorming, looking back at discussions that have happened in various council and commission meetings, various community meetings that we've been a part of, and looking at some opportunities for this funding. This funding is specifically designed to increase workforce. And so the concept that we have and what our goal is to work with each of our councils and commissions to really refine the concept before we launch any efforts towards this. But the concept is to establish aging and disability regional coordinators to serve as a liaison between the community, the healthcare partners, and state agencies. This concept is modeled after a concept that was established under the Division of Public and Behavioral Health for behavioral health services. And the idea is that having regional coordinators work in concert with advocacy groups, consumers, community partners, healthcare entities. They could serve as a convener of aging and disability service providers, healthcare providers, as well as family and peer advocates, provide education to healthcare professionals to promote awareness of the unique needs of older adults and people with disabilities, and increase access to healthcare services. The goal is to, well, so that's sort of the concept as a whole. What we are looking at now is really, as I said, getting feedback from our different advocacy bodies, and then moving forward with the steps that we have to take internally with the legislature to accept this funding and to launch a project. So I'll pause there for any questions, but it's kind of high level right now, and go forward from there.
Yeah, thanks, Cheyenne. This is so I guess I'm a bit confused because the last letter the executive team got from you said that the letter of assurances didn't get in on time. So you're
Oh.
actually going to be receiving this chunk of money?
So we have the opportunity to receive this funding from 5 different pots. We received it from 4 out of the 5 pots of funding
Coming from ACL.
from ACL, yes.
Okay.
So the one pot that we did not receive, to clarify for you, is the DSE pot of funding.
Okay. So, I mean, it all sounds good, Cheyenne, but I actually have something I need to say to
Sure.
you as our DSE rep and also Aging and Disability Services with the way that all of this happened. Okay?
Uh-huh.
I just am like deeply offended that not only as the chair of the SILC, but also as a person with disabilities and a consumer and someone who receives services through ADSD, I feel that you, Cheyenne, and ADSD were dismissive of the SILC and the role that the council plays as advocates for people with disabilities and educators of the IL philosophy, which says nothing happens about us without us. It feels like ADSD has not gotten that message as of yet. And I hope you hear me when I say loud and clear that when I say shame on you and shame on ADSD for your unwillingness to work with this council in the beginning and your handling of the way that this Part B money is being utilized. It's money that the SILC could have received through ACL, through you. It's in our spill, the very same spill that you, Cheyenne, worked with on developing, that you signed off on as the DSE representative. And when the executive team of this council first learned that this Part B money was coming through ACL, we immediately set up an appointment with you. We also asked RCIL to write up a proposal for this Part B money. Because after all, it's in our spill that any monies like this coming through ACL to you would come to the SILC. RCL, who could have, and would have been the recipient of Part B money, which I'll say it again, is in our spill. RCIL had a solid plan for how they could have used this award money to help people with disabilities in the community that they serve. And we were told that ADSD already had their own plans for that money. And we were surprised as the ACL encouraged the DSCs to work with the SILCs. I also put some of the blame on ACL, by the way, for the way that they worded the instructions for this. Just saying encourage meant that you had a choice. And we were locked out of that choice. We looked at your plan. We made some suggestions as well. But you were dismissive of the SILC and you closed that door on the attempts to work with you as a council and as an executive team. We were told that ADSD wanted to keep the Part B money for their own plan, which you're doing. A plan that we felt had very little to do with independent living and also the SILC. We were added to your proposal, but only as an afterthought. That's how it felt. We were placed last on that plan as working with us. Seriously, Cheyenne, I'm just absolutely astonished. Seems to me that ADSD had a plan in place all along, regardless of whether they were recipients of this Part B money or not. That you were going to go ahead and follow through on your plan, and you basically were not willing to work with the SILC and RCIL, who could have received that Part B money through the SILC as a subaward. They need that money. They work in the community. They know what's needing. And yet you just completely dismiss the council. At least that is how it felt as myself, as the chair, as a consumer, as a person with disabilities, and somebody who actually receives services from ADSD. I'm just beyond myself with this. So I'm gonna take a drink of water, sit back, see if anybody else has anything to say. Thank you for hearing me, and I really hope you heard me, and I really hope I was loud and clear about this. Anybody else?
I, of course, have something to say.
You're on, Dee Dee.
And I want the disabled community to realize what they missed out on and the proposal that we wrote. So, first of all, I want everyone to know that first and foremost, I am an advocate for people with disabilities. And I am absolutely appalled that you did not even consider taking a few moments to listen to what we proposed, or at least consider putting part of that in your plan instead of swooping in and taking all the money for what you felt was needed in our disabled communities. The State Independent Living Council and Centers for Independent Living know what is needed in our community. You don't. You are there to administer the funds. That is it. This is what people missed out on. Recently, the Nevada Aging and Disability Service Division left $80,000 in funds designated for Nevada Centers for Independent Living because they failed to sign a letter of assurance. Now, it's my understanding that you did get that taken care of, right? So I want you to know that this money should have been used to improve health services for people with disabilities in our state. Professionals supported through this program could have provided a wide range of public health services and supports, including provision of culturally affirmative and logistically accessible information, access assistance for vaccines and boosters, transitional and diversion from high risk converged settings in our communities, living situations, provision and connections to health and wellness programs, access to address social isolation and social determinants of health and other activities that support public health and well-being of people with disabilities. People with disabilities face many barriers to good health care. Studies have shown that people with disabilities are more likely than people without disabilities to have poor overall health and less access to adequate health care. People with disabilities and their families could have been given the tools to improve their self-advocacy in a medical setting. The 60% of doctors in Nevada who do not feel confident that they provide the same services to people with disabilities as those without disabilities could have benefited from the increased knowledge of how to make their practices more welcoming and accessible to people with disabilities. Instead of people with disabilities with healthcare problems who have been once again left behind because of a state agency whose priority is not with people with disabilities. It does not matter who should have received these funds, only that people with disabilities in Nevada have once again been left to fund and fend for themselves. I would like to make a motion to send a letter to the Director of Health and Human Services and the governor to voice my total and complete outrage, and the state independent living council's outrage that you swooped in and stole these funds from us at the SILC's displeasure at having these funds swooped up and not even a word nor even the ability to help make a decision of where these funds go. This is exceedingly unfair to the disabled community. And I want you to know that right now, as we speak, after this meeting, I am leaving to go to a motel room where a gentleman is dying from heart failure because he can't find a primary care doctor to be able to care for him. Those are the realistic aspects of what we face here in the disabled community. So take a real good look. I want you to know that I don't want you to take this personally, but I want you to know that I am advocating for all those people whose voices cannot be heard. And believe me, if they could, they'd be screaming right now. I cannot tell you how disappointed I am in the state of Nevada. Thank you.
Okay, thank you, Dee Dee. So I know we have some other comments, but we do have a motion on the floor. Because there's a motion on the floor, what I would like to do is see if there's a second. Yeah, I was gonna say if there's a second, hang on, Doc. I was wondering, do we need a second on that and then come back to discussion, or can we continue discussion?
I think Julie's trying to second.
Oh, Julie's trying to second? Okay, great. So there's a second. So let's have a discussion some more, and then we'll take a roll call vote. Okay? So I know that Julie wanted to speak as well. So I'm gonna let the council members speak if they want to, and then we'll go to a roll call vote on that motion in a second. All right? So Julie, go ahead.
I agree with everything that's been said so far. But I'd like to look at this from a different angle. We as a council want to make sure that this never happens again. So we need to work with each and to figure out. There needs to be a plan in place in addition to the spill, I guess, because the spill didn't protect this money for us. So there needs to be a plan and an agreement with your agency about if money's like this available again. How we're gonna work together to make sure the funds are appropriately dispersed and that we as a council get a say in where it goes. Thank you.
Mary Evilsizer has her hand up. Ace.
Thank you, Julie. Mary, go ahead.
Great. For the record, this is Mary Evilsizer. Okay, a couple of points here. One is from an administrative point. The funding that came out, the Centers for Independent Living, the Part C, we watched it very closely. We watched it roll out. We watched it roll out to the states. I did not know that the SILC was interested. It appears this was an executive committee decision. Also, I'd like to point out, we need to be very clear because somebody mentioned, and I don't know who, that, okay, that it's in this bill, that RCIL is in this bill. Okay, for the record, I worked on this bill. And the Centers for Independent Living that were cited in this bill are the Part C. The Part C Centers for Independent Living. RCIL is, and then Dee Dee, my heart goes out to you because I know more than anything, you want to be a Part C center. And I want to say, you know, it is not the existing Part C centers that block you from being a Part C center. Nevada has not had an expansion since we had the satellite offices back in '95. The increases we get are minimal. I think the last time we got a cost of living increase was 8 years ago. So the existing Part C centers are not the block.
Mary, let's keep on the topic. We're
Okay.
talking about this, the Part B money coming from ACL itself, not any. If we could go back, please, to the topic at hand.
Right. Let me go back to the administrative point. Okay.
Yeah, I want to speak directly to Cheyenne and what happened, you know.
All right. Well, that is my point. I want to say that, okay, as a SILC member, I did not know that this was going on. I know it came out fast and it came out quick. And then also, but to have a CIL that is not recognized in the spill, I think it would be a lot better to have a CIL recognized in the spill. So those are my points to make. Also, again, there's some other news and information regarding this money, but again, you want to address Cheyenne. So those are my points. If we're going to do something together as a SILC, let's work together and let's stay to our points and make sure that we're administratively correct. Thank you.
Thanks, Mary.
Ace, this is Dawn, Mayor.
Dawn, yeah, go ahead, Dawn.
This is Dawn Lyons for the record. Just to address what you're asking, Mary, we found out as an executive team about this funding after our last SILC meeting. So we knew that it would be a topic at this meeting. We just didn't know that it would have progressed to this point by this time. So we weren't leaving the SILC out. We were simply trying to be proactive and have something ready for the SILC to approve, even though that never came to fruition. So, and in our spill, in our state plan for independent living, it specifically states that if any additional Part B funding comes from ACL, that would be applied to our current subawardee. It doesn't say RCIL, but RCIL just happens to be our current subawardee. So that's why we had Dee Dee go ahead and write up a proposal.
Okay, okay, we'll discuss this bill later.
One other thing I'd like to say though is it would have been really great to work with the Part C Centers for Independent Living on this funding and have some say in what happens with the disability community, but we didn't even know that you were receiving the money. So that's also something that I feel is a little bit uncomfortable for us, especially since we're supposed to be working as a network and as a team. That I heard more from what the DD Council was going to do with their money and what the Nevada Disability Advocacy and Law Center were doing with their money than I heard from the CILs. So I just wanted to mention that, and also that, my concern moving forward also is that if we weren't included, if the disability community wasn't included in conversations about this, how are we going to expect to be able to trust that we'll be included properly when it comes to planning for Olmsted?
That we have to work on, and with the commission. The SILC has to work closely with the commission because we have to be included for Olmsted. But as I said, this happened fast. It happened fast for the state. It happened fast for the CILs. We have to sometimes take action in a quick manner, where it would be nice to have, all inclusiveness, but things are happening fast right now. And as I said, I did not know the SILC was even interested or involved. And, but I think that does lead us to the communication that we're trying to engage in, and the work and the inclusiveness that we're trying to do. And I think everybody here is just trying to do the best for the disability community. We come from a state with really limited resources, and a state where we have to just use what we can in the best way that we can, but to include the disability community. As Part C centers, I guess they're recognizing us as that we're part of the disability community. So ACL felt that it best to include us.
Yeah, well, thanks, Mary. But we did. I mean, that's what that was the thing. It happened right after our last council meeting. So the executive team was notified, and that's why we tried to jump on board. We tried to set up meetings with Cheyenne. We tried to communicate. We even looked at their plan. We presented the proposal from RCIL, like I said, who would have been the recipient. Because they would be our subaward Part B recipient, and then we would have brought all of this to the council for a discussion, but we didn't even have a chance, Mary, because I feel personally, as the chair and part of the executive team, that the door basically was closed on any discussion moving forward. ADSD decided on their plan. They were going to follow through on their plan no matter what. And it was just, we were an afterthought. So that's why the executive team tried really hard to get in the door, tried to start some form of communication with the DSC. And we even, like I said, we looked at their proposal and tried to give them some input on that so that we could bring it back to the council, so that the council would be aware that this was happening. Only it just fell apart.
It fell apart. One last comment though. Okay, we're talking that we were all working under a very rapid time pressure, and Cheyenne, well, I don't know, but I imagine ADSD was working under the same pressure.
So this is Cheyenne. I have a couple of comments that I would like to make, but I would like to let any other council members, if there's other council members that have comments that they would like to make, I will hold
Yes.
mine.
Yes, this is Ace. We need to, if there are any other council members that have anything that they would like to add. And then we also have a motion and a second on the floor. So I need to follow through with that as well. So are there any other, is there any other discussion so far from what the council members have heard?
This is Dawn Lyons for the record. I would like to ask Dee Dee if it would be okay to amend that motion to include a letter to ACL expressing our displeasure at how they handled this particular bucket of funding and lack of communication between partners.
That sounds great, because I think that we should have at least been able to put some input into the decision that was made. And I think that we needed to be able to have the opportunity to work with them on a plan. And we just were ignored. The door was slammed in our face. And are we upset? Yes, we are. But communication solves a lot of wonderful problems. But in this case, I think that some action needs to be taken promptly and strongly, because I think the disabled community needs to be considered to at least be heard in issues that are related to things that concern them. And I think that that's my main issue.
This is Dawn. May I, Ace?
Yeah, go ahead, Ace. Go ahead. Sorry.
Dawn Lyons. I guess I'm thinking that instead of writing a letter to the administrator of DHHS, I think it may be possible to work directly with ADSD to have some kind of an agreement in place, maybe even amend our MOU to, specify what we should do in cases like this, or if something like this were to happen again. Like Julie said, it would be a proactive way of handling it. And rather than going and complaining, I think we could come to an agreeable solution if we were to go that route.
Okay, so this is Ace. So we had a motion on the floor with an amendment. And now making another.
So what
make a motion again, Dee Dee, please. And then
I make a motion to send a letter to ACL as well as Health and Human Services and the governor to state our displeasure in decisions being made without us in regards to us. And I guess that's my motion. That we all learn to work a little bit better together.
thanks, Dee Dee. Okay, so I'm trying to make sure that we're doing this correctly. My mind is kind of boggled right now. So okay, so now we have a new motion with an addition there, an amendment. So let me get a second on that, please. And then we'll do a roll call vote, and then and we'll go from there. So is there a second?
This is Sabra McWhorter. I second.
Thank you, Sabra. Wendy, could you please do a roll call vote?
Yes, I can. Did Evander Davis join us?
Aye.
Hi, Evander. Okay, thank you. Mary Evilsizer,
Aye.
Dee Dee Formaster,
Aye.
Saber McWhirter.
Aye.
Did Raquel O'Neill join us? Okay, Kate Ostie. Renee Portnell is gone. Ace Patrick
Aye.
and Julie Weissman Steinbach.
Aye.
Thank
Kate
you.
also unmuted. Kate, did you have a vote?
I'm sorry, I thought I did vote. I said aye. Sorry.
Okay, this is Stace, that carries. So, and Dawn, I would like to go back to what you said about having an MOU in place. Just so that, you know, Cheyenne, is not a personal thing. It just really, the way it rolled out, I think made a lot of us very upset at this, and we really want to continue. We've had a really good working relationship with our DSC. Just the way it rolled out and the way things happened, it just was, it just did not set well with many of us. Anyway, thank you for being here, and I know you have some more to say. And so I'll get off my soapbox now and allow you, because we really want to continue our working relationship with aging and disability, and also you as our DSA rep. So thank you again for listening and hearing us out. And I'm going to give you the floor again.
Well, thank you. I will keep my comments brief. I just want to say thank you to everyone for your comments, and it was quick. It was confusing in the way that messaging was being sent out by ACL, by other entities. We can always do better. And you guys know that I am, as your DSC rep, I am in your corner. I have your backs. When this concept was first put forth, I looked at the spill to determine how it would potentially impact the goals and objectives of this spill, and how it could help the SILC to accomplish the goals and the objectives. And I felt that it was in line with those goals and objectives. And then we began the conversations. In the meantime, you guys had gone down a path of planning on how you would want to spend the money. And so it was sort of a lot going on. But can we do better in the future? Absolutely. Will we do better in the future? I'm going to try my hardest with whatever power that I have. So, and I know that the agency is committed. We did not make these decisions in a vacuum. We made these decisions based on what we've heard from the community. It may not feel that way to you, and for that I apologize. So we can do better. And this is a learning opportunity and a growing opportunity. Unfortunately, as I mentioned, we actually, after all this is said and done, Nevada did not receive the DSC money. However, that does not preclude us from continuing to look at how do we best roll out this plan to serve the needs of the disability community, in addition to the aging community. And so I hope that we can continue to have those conversations as we continue with our really the boots on the ground planning now, and move forward in a way that meets everybody's needs. So I appreciate you guys. We will do better together, and thank you very much.
This is Ace. Thank you for saying that, Cheyenne, and thank you for being here today and spending time and listening to us.
I have a quick question.
Go ahead.
This is Dee Dee Formaster for the record. How much money was left on the table?
So this is Cheyenne, and it was $80,000.
That could have been a lot of money that could have helped with a lot of waiting lists that are sitting there providing or not providing resources for people with disabilities.
Yep.
So I think that's pretty alarming. 80,000 is a lot of money. Thank
This
you.
is- Yeah, this is Ace. Thanks, Dee Dee. Cheyenne, could you just before we move on, could you clarify exactly what happened? I mean, how is it that the letter of assurances didn't get in on time for that?
So I don't actually have a good answer for that. In the variety of conversations that we had, we were holding off on the submitting the letter of assurance, and on the day that it was due, it got overlooked. I did not realize it until a while later, and once I realized it, we reached out to ACL to see if there was any options, and unfortunately it was too late at that time. But like I said, we are continuing to go down this path and make sure that the needs of the disability community are included in this plan. So we're going to do better going forward. And I apologize that you all felt left out and had the experience that you did. So.
Katie has her hand up again.
Who does? Who has their hand up, Dawn?
I have my hand up again.
You do? Okay, Dee Dee, go ahead.
I just wanted to ask if she was aware that those funds still are available, but they have to be applied for by ACL. They're still available till 2024.
So this is Cheyenne. The specific pot of funding that we are talking about is DSE funding. And we reached out to ACL and they informed us that we were not able to receive those funds.
Did they tell us why we couldn't receive those funds? Because they can reapply.
They did not.
That's a question I would like an answer to. I want to know why we have $80,000 that was left on the table and why ACL will not reapply for it.
I will do some homework and see what I can find out.
Thank you very much.
Yeah, thanks. This is Ace. Thanks, Dee Dee. Thanks, Cheyenne. Yeah, I think the SILC would really like to know why the letter of assurances was held off, why it was being held back, and why it didn't move forward. You know, that's a bit confusing to me as well.
This is Cheyenne. So I held off on submitting it simply because we were continuing to have conversations with the executive team. And then I did not even realize that it did not get submitted on the due date. And it was an oversight on my part, and that's all I can really say. So
thank you. I appreciate
it was a mistake that I feel deep regret for. But the only thing I can do now is take the funding that we did receive and continue to work with the SILC, with other members of the disability community, and make sure that you're represented as we move forward.
Thank you, Cheyenne. I really appreciate that. I appreciate you taking the responsibility as well. Like I said, it's not a personal attack. It's just, because I do consider us having a good working relationship with you and as our DSE rep. So I appreciate that from you. So was there any other, Dawn, did you have something else you wanted to say or?
No, we will bring those letters back to the next SILC meeting for approval.
Thank you, Dawn. Okay, thank you all. Thanks again, Cheyenne. I really appreciate, your willingness to stay and listen and hear our feedback.
Thank you for your comments. Have a good afternoon.
You too, Cheyenne. Okay, I'm going to switch an agenda item around and address this one first, and then we'll move on to item number 11. This should be just a really quick thing. So I apologize to Jackie. But this should be a really quick thing for us to get through, and then we will move on to the discussion that you have for us. What I would like to do is bring up item number 17. If people look at their agenda, this is a discussion oh, sorry, I just got kicked out for a second. This is a discussion and a vote. I would like to recommend that member Eric Jimenez be retired as a council member to Governor Sisolak, who's the Nevada SILC appointing authority. We would need to write a letter. Eric has not shown up for many council meetings now. While I understand that Eric is busy, he still agreed to be a council member, and he's not been here. And the executive team has reached out to him on numerous occasions, and we've not received a reply back from him. So what I would like is a motion to write a letter to Governor Sisolak to recommend that Eric Jimenez be retired as a council member. Somebody willing to make that motion?
I'll make that motion. Or I guess Julie is making that motion.
You can fight to second it. So
I can second it, Julie. Thank you.
okay. Julie made the motion. Dee Dee second. Wendy, can we do a quick roll call vote, please?
Yes, we can. Evander Davis,
Aye.
Mary Evilsizer,
Aye.
Dee Dee Formaster,
Aye.
Saber McWhirter,
Aye.
Kate Oste,
Aye.
Ace Patrick,
Aye.
and Julie Weissman Steinbach.
Thank you all. That passes. And we'll get right on that. And that will open up another space for an ex officio to serve on the council. Okay, thank you, Jackie, for hanging in with us. I really appreciate you being here. I'm looking forward to item number 11, which is a discussion and make recommendations regarding home and community-based services and changes surrounding personal care services. And Jackie Obregon, I'm hoping I'm pronouncing your last name correctly, is here today to speak to this. And so I would like to give you the floor, Jackie.
So, thank you. Like I said, or like I mentioned earlier, out of turn, sorry. My name is Jackie Obregon, and I oversee the personal care services program for Nevada Medicaid. But this is, I wasn't sure what you were wanting to talk about during this this time.
This is Dawn.
So,
This
yeah.
this is Dawn Lyons. Ace, may I?
Yeah, John, go ahead and jump in.
So I'm sorry for the confusion on this agenda item, Jackie. I think you understood it as you were here to answer our questions, not present anything. And I think that in our agenda item itself, there is a link to Medicaid's page that it describes all the things that they've done with the ARPA money. I can't remember what that stands for off the top of my head right at the moment, but the ARPA money that they've received to help the PCSs or help the PCS services that Medicaid provides. And I think part of that was the $500 bonus that went out to PCAs. And there were some other items on there too. I hope you all had a chance to review that. I know we discussed this at the transition work group, and we had a lot of questions for Jackie at that time, but I'm not sure who's here who remembers that conversation that still has those questions. But I wanted to make sure that we had a chance to ask them. So we invited Jackie back so that we could ask her any questions regarding that funding and regarding any increases in the pay rate for PCAs, which I believe Stephen Cohen sent me, and I had forwarded to the group the report on those rates increases and the suggested rate increase, which I think ended up being a high end of like $16 and something cents an hour, which is barely a living wage really, but it's a lot better than it is right now.
Yeah, so I will try to answer as much as I can. I do have to say that even though it does relate to my programs, the ARPA funding and all those funds and the rate increases, how the rate methodology and how that is being handled, because it is rate related and it's got to do with reimbursement, is being handled by the rates reimbursement unit. So it's being handled by a different unit. There is a specific group that is handling all this. There is a specific inbox and an email that has been put together for questions, for anybody who has questions in regards to what is going on, any specific questions for providers who have questions, suggestions, anything with it. I can tell you that there's 4 initiatives. The first initiative was, the $500 that were going to be reimbursed for eligible PCAs, for every eligible PCA, but the $500 were going to be given to the agency. So each agency had to apply for it. So we weren't just going to give the agency $500 for every PCA. So as an agency, the agency had to apply for it. They had to submit a roster with all of their PCAs, and they had to be obviously active, providing services, and they had to be eligible, meaning that they had to, meet certain qualifications. And there was a number of qualifications. Of course, they had to be actively working. They had to have valid, NPI. They also had to be, they didn't have to have any negative Medicaid, they Medicaid standing. So they didn't have to have any negative Medicaid standing out there. So, but all that was also, again, being verified and checked by our provider enrollment unit. So there was different units that had different parts in it. So our piece of it was to verify that, yeah, indeed, the provider was providing services. The PCA were providing services because we were able to check that with through our EVV system. We were able to verify that if they were indeed providing services. And so we provided reports with that information. So those, that was during the month of December, they were applying. And so those checks went out. I believe those checks went out in March. So those checks went out to the agencies, and the agency then had 30 days to provide those funds to each of the eligible employees. If the employee no longer worked for that agency, then those monies had to be returned back to Medicaid. So that's initiative number one. Initiative number two is that that increase. It's anywhere between 15 and 29%. Most of the agencies are getting the 15% increase, and how that's being determined is based on paid claims in a quarter. So if, for example, for the last 3 quarters, and this is just an example, for the last 3 quarters, they're going to go ahead and see how many, they're going to total all the claims that they were, what we paid. They're going to average, or however it is that they're computing that number, and they're going to, it's 15% of that's going to be the increase that they're going to get. And then they get a percentage of that. That's the 15% they get. If the provider is a rural provider, then they get an extra, I believe it's, I have that number. They get an extra 14%. So which is what equals the 29%. So if they're just, the regular, agency in Reno, they'll just get 15%. If they're, Winnemucca, they, get 29%. But again, like I said, those are all being handled by our other units. But I can definitely, try to answer as many questions as I can. And whatever questions I don't have an answer for, I can definitely take back and provide responses back to you.
Hi, thank you very much, Jackie. Why is there a discrepancy so much between like what Winnemucca would get and Reno would get? Do you know at all, or
Well, that was just me comparing, the rural areas are, the ones that would get the 29% per se. Those are the ones that are getting the higher rates, just because, they are the ones that are, we need more providers in the rural areas. And I guess it's just to incentivize, providers to get out there, and for us to be able to have more providers out in the rural areas, and maybe that incentivizes them to be out there and the first payments that are going out, those are going to be from April 1st of 2021 through February 28th of 2022. So all of those claims for all those providers, active providers, they're going to get that payment for all those claims. So they're going to get 15% of all those claims, or 29%. And then going forward, the payments are going to be quarterly. So basically, starting March of 2022 through June of 2022, they will be issued, I believe it's July of 2022. So yeah, so March through June is going to be issued in July, and then every quarter after that. And the discrepancy in payments, like I said, I'm not exactly sure how rates went ahead and computed that, but I can certainly find out.
just to say thank you. Yeah, because I have a PCA, kayaks, and she told me today, because I was talking to her. She did. Fortunately, she's with an agency that did apply for that $500. Sorry, my dog is barking here. and she does work with an agency that made sure that just a couple of PCs they have that are under the Medicaid, that they did receive that. But she said, it wasn't enough. And she said, actually, from what she understands right now, that Medicaid wouldn't allow her company to pay her more than she's getting like $14.98 an hour or something like that. And I was asking her about that, and she said, yeah, it's not even enough to really live on. She still is living with her parents. She has a small child. And she said, I can't even get out of the house. And she actually comes from a rural area into Reno. So she's got this long drive, this long commute. And she works with people here in Reno. And with the cost of living going up here in Reno in particular, I don't know what it's like in the rurals, but oh my gosh, the cost of rent and everything else, it seems like there's just this, it seems off balance to me, but I don't know, I'm not a numbers person. And I'm just curious because she was saying she's not even making $15 an hour, and she's so.
Yeah, and unfortunately, and we don't, Medicaid doesn't determine what the agencies pay their staff, their PCAs. I mean, what we determine is what we pay an agency, what our rates are for the services that the agency provides. And but unfortunately, we can't tell an agency what they can or cannot pay a PCA, but what we can is we can encourage the providers who receive these supplemental payments to use portion of these funds to for their direct staff, for their expenses such as salary increases, stipends, or even other related expenses that they incur, training costs. We also have mentioned that this supplemental payment can be used for the provider expenses such as PPEs for their their personal protective equipments, infection control, equipment, anything that they can offset for their employees. And we're trying to, that's what we're trying to do with this money, is to offset the impact of COVID that providers and their employees have experienced during this time. We understand, and I mean, believe me, I have to commute every day. Even though I'm working from home, I commute every day back and forth to Carson. And with the prices of gas, believe me, I totally understand. And it's hard, and we get it.
Yeah, thank you, Jackie. Yeah, it really is, because if I send her out to do grocery shopping and she's also using her own vehicle, and the problem in the past has been, I mean, right now I have an excellent PCA, but the PCAs haven't always been great because there really hasn't been. I mean, I live in Sparks, just outside of Reno, and there's no real incentive. The incentive is to work for private pay clients instead because they make more money. And some of the people we get aren't necessarily well trained because doesn't seem to be, I don't know, it just doesn't seem like it seems like people with disabilities, once we get PCA, we actually are the ones doing the training, which is understandable because we all have different needs. But still, there have been some PCAs I've had that just, they don't even really know what they're doing. And also too, I just would like to see Medicaid move into offering more incentives besides just a little increase in pay. or a little increase in mileage that they get when they go shopping for us. I'd really like to see somehow that Medicaid feels like PCAs are as important to us as we feel they are important to us, and offer things like, insurance coverage for these poor PCAs. There's no insurance coverage for them. They have to pay it on their own, from what I understand. Also, too, there's no real educational opportunity to grow and maybe move into becoming like certified CNAs working with us. I was trying to think of some of the other things the transition committee has sort of considered. It just seems like if Medicaid was willing to somehow hear that our PCAs need more than just a little bump up in pay.
This is Dawn. May I, Ace?
Yeah.
This is Dawn Lyons. So first, I'd like to express that I think I understand a little bit of the barriers that happen here. Is the reports that are done on, or the study that was done on the wages and stuff, like she said, is not done by Medicaid. And they're done from numbers that were back in 2018, 19, were never in real time. So as desperate as we've gotten, it's hard to make up for that. But that's why the ARPA funding came in to help with that. And I think that's what Jackie's talking about, Medicaid is trying to accomplish. What I'd like to see, actually, Jackie, is if you could get to us maybe a one pager that tells us, how much was required to go towards training, how much was required to go, that Medicaid dictated as far as that goes, or how Medicaid sent that money to the provider and with what provisions, the specifics of that would be awesome. And then we could just share it with the council. And if we had more questions, I could email you about that. That would be really great. Dee also has, oh, sorry, go ahead.
Okay, I can go ahead and share, and I believe I can insert it maybe in the chat, but we have, we've created some FAQs, and they have some information on them maybe that could and cannot be helpful. I can put the last two that we have out there, the one for the $500 payments that we put out, and the one for the current one for the increase. That's just the second incentive, and I can insert them or email them to you, however you want.
Sure, I think I remember reading those. Did they actually have a breakdown of how they were supposed to be distributed?
Well, we, like I said, we make suggestions as to how we want them to do it. But again, at the end of the day, it's up to the provider if they go ahead and,
So this is really, there's
provider does it or not.
there's no real oversight as to making sure that the PCAs are actually receiving that. I mean, if it goes to other things and the PCAs are left out of the equation possibly.
Correct. I mean, we could possibly, like I said, we encourage providers, we are encouraging them to, receiving these funds, hey, you guys can use the portion of this funds.
Put it off till tomorrow then? Okay.
And
Yeah.
if they're if that's what they're
Preparation for
you.
Excuse me, Cindy.
Just a second. Excuse me.
So
Is that
I will
Cindy
find
again?
some of my numbers.
Somebody's
and
on, needs to
numbers
mute.
for Talking with them.
I
tomorrow.
can mute you, Cindy,
Alright.
if you can't.
Yeah, Cindy, please mute again.
Gotten quiet though. Okay.
Okay, thank you. I'm so sorry, Jackie. Just couldn't hear.
Yes, no, that's fine. Like I was saying, we can encourage the providers to do this, and but there isn't anything that we are currently doing to make sure that they're complying what we are with the requirement that we're asking them, to do with what we're asking right now. I mean, that doesn't mean that, going forward, it's not going to happen. It just, That's what, how it is right now.
Thanks,
So
Jody.
Dee Dee has her hand up, but I also wanted to remind us that we have about a half an hour left of our meeting.
Yeah.
And we have quite a few more agenda items to get through.
Yeah. Okay. So, yeah, thanks, Dawn, for that reminder. So, Dee Dee, go ahead. Sorry, Jackie, I know these are hard
I
questions
just have a quick
that we've
question.
been talking about and pondering, especially those of us that have PCAs. So, Dee Dee, go ahead and then.
I have a quick question just for Jackie. I was wondering, Jackie, do PCAs still work? Are they still able to work for themselves as far as not going through a provider, therefore receiving more pay?
So we do not hire, we do not contract, I should say, I shouldn't use the word hire. We do not contract directly with a, we do not contract directly with PCAs. So we contract with the agencies. So if the agency would have to be hired on by, or excuse me, the PCA would have to be hired on by the agency. So unfortunately, at this time, we are not at the point that we are hiring PCAs directly. If later down the road, Nevada Medicaid decides to contract with PCAs directly, and go through the enrollment process, that all the PCAs actually become providers, then at that point in time, every PCA can enroll as a Medicaid provider and provide services to as many recipients as they want directly. But at this point in time, a PCA works for agency A. They can work for agency A, B, and C, but they have to work for an agency.
Yeah, once money follows the person comes about, which I have been waiting centuries for, PCAs then be able to be paid directly? Because I think that might kind of solve some of these problems. It used to be in the past that PCAs could just work independently of agencies. And I'm thinking that we need to get back to that, because maybe that way the PCAs would not be controlled by their pay by the entity that they work under. So maybe that's something we need to shoot for in the future.
Okay, I can take that back.
I used to be a PCA way back when, and at that time, we just had to pay for our, they had certain things in place that we had to do before we were eligible to work on our own. So we had to have insurance, workman's comp, and stuff like that in place. But we didn't have the overhead of agencies back in those days. So I was really paid a pretty good wage. And maybe that's something that the SILC needs to consider maybe taking up in the future, is maybe writing a letter about that to Medicaid, so that maybe more independence as far as money follows the person would be a better situation.
Thanks, Dee Dee. Maybe we can, the transition committee, take some of that back to the transition committee, and Jackie can take all of this back as well. And we can invite her back and invite her to the transition committee itself, and we could go from there, and then we can bring stuff back to the SILC again. So
This is Dawn. Can I make a quick comment?
sure.
This is Dawn Lyons. Thank you, Jackie, for coming today and for answering our questions.
No problem.
And I wanted to also say, I agree with Ace that we can bring this to the transition work group and talk some more about it. I did go to the self-direction conference, which talked about, which I actually saw some Nevada people there from Medicaid and from HCBS, and and it looks pretty positive, like Nevada's moving in the right direction in that regard. So there may be some future possibilities for the consumer to be the employer in the future. We'll need to keep a close eye on those conversations and maybe make sure that we're a part of them. But we can talk about that at the transition work group. And I just wanted to mention that really quickly.
You froze out some point in time there, but I heard most of it.
Yeah, this is Ace. Thank you again, Jackie, for being here, and we definitely would like to have you back and maybe have you come to the transition committee so that you can hear more about the concerns that we have. So
no problem. And if you guys have more questions about ARPA, as we call it, go ahead and you guys can, if Dawn, you want to send the questions over, I can try to answer as many as I can, or try to find the answer for you, and then I can bring them to the next meeting, or send you the answers before.
this is Ace. Thanks, Jackie. I know that's probably what Dawn was going to say. Yes, and thanks. I will do that, especially once the transition committee meets again. So thank you again. I'd like to move on to the council so that we can, because I want to make sure we have enough time for public comment at the end. So again, thank you, Jackie, and we will see you again. Hopefully.
No problem.
Okay, thanks. Let's move on to item number 12. I want to try and get 12 and 13 done as quickly as possible. We're going to run out of time. I want to allow time for public comment. We have a little less than 15 minutes because I want to allow about 15 minutes for public comment if possible. And we may have to schedule another SILC meeting to finish out the agenda items. And I would let Dawn take care of making sure that, that we all find a date for that, because I don't know, we're not going to finish getting through stuff. So the next item is 12. Which is to discuss and approve the Nevada SILC Policy and Procedure Manual, the 9th edition. Dawn has made a few changes and recommendations for the language. I know we got somebody. Cindy, can you make sure, please, that your mute's on?
Yes.
Thank you. Anyway, I hope everybody was able to see the document that Dawn sent.
Maplebrook 2 book club docs compatibility mode escape.
I muted Cindy.
Okay, here we go. All right, are there any questions or discussion?
No, this is Dawn Lyons. I'd like to go ahead and present just a little more information about the Policy and Procedure Manual.
Please do.
The 9th edition, the only addition I added was the special reimbursement section at the very end. And that is because we were able to work with Community Chest, just like the DD Council does, so that we can have access to funding that we can provide reimbursements through them in order to be in compliance with our bylaws. So that's really all that's about. And it's so that if, you run into expenses such as transportation or childcare or missing work for these meetings that we attend, that the SILC is able to reimburse you without you having to become a state employee and go through their onboarding process, which is what their current policy is right now. So it's just a way around that we've found, that we can go ahead and be in compliance with our bylaws and help people out that way. The language itself, I'll let you comment on if you want, but there was one other addition that when I sent this out, that Dee Dee Formaster actually sent me, that she had suggested that we include changes on. And really what I think it was she was concerned that we were referencing CFRs and language in the act, but we weren't using the specific language from the act. And I guess my counter argument to that would be, we don't need the act in our policy and procedure manual. It's really just a reference so that we know what section of the act we're taking our policies and applying from. So they don't even have to match exactly, as long as it's not deviating from them, in my opinion. But I wanted to make sure that everybody else has a chance. And Dee Dee's just rejoining us, so she didn't even hear me say that. But anyway, I wanted to give everybody the chance to weigh in on that if they agree with Dee Dee that we need to change the language to be just like the law, or if it's okay that we're just referencing the law that particular policy applies to from. Anybody have any thoughts on that?
Yeah, this is Ace. Thanks, Don.
Dee Dee, just to catch you up, I was just letting you know, or just letting everyone know about your suggestions to change our policy and procedure manual language to what it specifically states in the CFRs. And my argument against that was that we apply our own policy and procedures, and that we are just referring to those specific areas in CFRs when we're expanding on them. So I wanted to let you weigh in on that too, and let people know where you're coming from.
Well, basically, of course, I don't have it in front of me because my computer just quit working. Basically, the first one refers to what is stated in the law, and the law is referenced. So I think that it would be important, if the law is referenced, to have it stated like it reads in the law, because in the future, we want to make sure that they are working with a document that is legally, basically that is legally the same as the law. And on the second one, it is, the way it's written is kind of an oxymoron. It basically says that, and I don't have my notes with me, so you're gonna have to bear with me. It basically states that if you're a CIL and you basically it states that if you're a Center for Independent Living, that I'm gonna have to look at my notes, Dawn.
Would you like me to read it?
Yeah, that would be great.
Yeah, please do. This is
Okay.
Ace.
This is Dawn Lyons. So what it currently says in the manual right now is all official council and committee meetings will be planned, posted, and held according to Nevada open meeting law requirements. The SILC shall meet at least quarterly according to federal guidelines. And I referred to the CFR. And then what Dee Dee would like it to say is specifically what the 45 CFR 1329.15A3 states is the SILC shall meet regularly and ensure that such meetings are open to the public and sufficient advance notice of such meetings is provided. Let's just talk about that one first. And let me just explain why I think the current language is better, because it's more specific to what we want in our policy and procedure manual, rather than just quoting the law. Because we're in compliance with the law, but then we have a further step that we want to meet quarterly. So that's what we put in our policy and procedure manual. Dee Dee, I think you're saying that it's somehow going to not be legally binding if the actual legal language is not included.
Well, the legal language that is actually stated, well, is not stated, but is referenced. So it's referenced, but it's not stated like the law is stated. And so that's my concern. And I think it's okay to maybe reference the law, put that in there, and then state that the SILC board has made the decision to meet quarterly. I think that that would be okay.
Anyone have any opinion on that?
Well, then I'll just throw it out there and say, I'm going to make a motion to.
Wait.
Can we go over the second one first and then we can make a motion?
Yeah,
go over
and
the
actually,
second one too.
Dee Dee, I think I kind of understand where you're going, but I think when we initially did this, we really wanted to make it sort of concise and condensed, and so that it was in plain language, so that everybody could understand it without having to, because the law is cited there. So, but I don't know, you know, I kind of want to get through this if possible, because we're kind of running out of time.
Yeah, and I understand.
Yeah.
So.
Can we maybe, I'm sorry to interrupt. This is Dawn Lyons. Can we maybe look at this portion of what you're suggesting, Dee Dee, in our next meeting?
Yeah.
And decide whether or not we want to change the language of our policy and procedure manual where we reference the CFRs next time when we have more time to discuss it, and just go ahead and someone make a motion to approve the special reimbursements portion and go forward with the 9th edition at this point as written. Would that be okay?
Well, I kind of hate to delay this because it's important that we get it in place as soon as possible. But if, can we maybe, I think it's okay to put plain language in there, but I think if you're going to cite the law, it needs to be in there, and then either put the plain language below. But the second one that I am proposing is really very much an oxymoron. So can you read that, Dawn? Because I don't.
This is Dawn Lyons for the record. Right now, it currently says, according to 45 CFR 1329.17 D23, not less than 51% of CILs will participate in the development and approval of this bill. All participating CILs must be willing to share proof of their Part C approval upon request by the SILC. Oh, I'm sorry. No, that's what eligibility of centers for independent living for spill inclusivity is. what Dee Dee is proposing that it should say is 45 CFR 1329.17D1 says developed by the chairperson of the SILC and the directors of the CILs after receiving public input from individuals with disabilities and other stakeholders throughout the state. And then the other part of that is where the spill must be signed by, and that's 2III, not less than 51% of the directors of the SILs of the state. For purposes of this provision, if a legal entity that constitutes the CIL has multiple Part C grants. I think it's too complicated and it's hard to understand. And the way that the SILC has it written is that where is it? So yeah, so that 51% of CILs will participate in the development and approval of this bill, and all participating CILs must be willing to share proof of their Part C approval upon request by the SILC. So I think it's just more clear. That's all.
Well,
Yeah, Dee Dee, sorry, this is Ace, because we really are running out of time and I really need to get to another agenda. I have time for
Okay.
comment. So what I would like to do is maybe the council members can have more time to look at this. I know you want to push this through as soon as possible, but I think it requires a bit more discussion and time.
that's fine.
Thank you, Dee Dee. I really appreciate that. So I want to go back to what Dawn was proposing, that a motion.
I'm looking for a motion to approve the Policy and Procedure Manual 9th edition as it's written.
So moved. Is there a second?
This is Kate Osti, I second.
Thank you, Kate. Wendy, can you do a quick roll call vote, please?
Hold on. Are you able to hear me?
Yeah.
Okay, thank you. Yes, we lost power here, so I'm just
Yeah,
on my
that's-
little laptop right now.
That's
Okay.
what happened to me too.
Okay,
The winds are heavy, yeah.
okay, Havander Davis,
Aye.
Mary Evilsizer,
Aye.
Dee Dee Formaster,
Nay.
Sabra McWhirter,
Aye.
Kate Osti,
Sorry, aye.
Ace Patrick,
Aye.
and Julie Weissman Steinbaugh.
I believe Julie had to leave.
Okay. And that's the last member.
Okay, great, thanks. It passes. Dee Dee, thanks for your patience. We will revisit this when we have a bit more time for discussion, okay? We really
Okay.
just wanted to get that little piece in there.
Yeah, and I'm sorry I don't have my notes in front of me, but with the power outage, it threw all my notes.
I hear you. We'll
the door.
revisit that. We'll revisit that. So let's quickly move on to number 13, because I want to get through this. The discussion approval of the 2022 and 2023 Nevada Silk Subawards. Dawn, quick, please.
Yeah, I will try. This is Dawn Lyons for the record. Fortunately, they were included as meeting materials, all the proposals. The two Part C centers basically asked for the funding for 2023, the same as they asked for it for 2022, I believe. So that should be a no-brainer. And then RCIL as well, which we already awarded her for 2022. And then the only other one that's included in there goes hand in hand with the budget. They're not really budget changes, they're just budget realignments, so that we could provide a sub-award to Community Chest in order to provide reimbursements for SILC members and participants that we want to help support based on our bylaws. So that's what I've got. And I'm just looking for a motion to approve those fiscal year 2022 and 2023 sub-awards so that we can move that forward to the DSC as their deadline is quickly approaching.
So moved. I would like a second on that, please. So a second.
Second.
Thank
Amanda
you.
Davis,
Commander.
second.
Thank you. Thank you. That was Evander. Thank you, Evander. Okay, Wendy, can you do a quick roll call vote, please?
Yes. Okay, Evander Davis,
Aye.
Mary Evilsizer,
Aye.
Dee Dee Formaster,
Aye.
Saber McWhirter,
Aye.
Kate Oste,
Aye.
Ace Patrick,
Aye.
and Julie Weissman Steinbach.
Dawn, did you say she had to leave?
Yeah, she had an urgent situation.
Okay, thank you.
Yeah. Thank you, Wendy. Okay, it passes. Thank you very much. Thank you much, all. I think we're gonna have to think about.
Ace, may I
Yeah.
make a suggestion?
Yes,
This
Dawn.
is Dawn Lyons for the record. Rather than creating another meeting, I know I had lots to say about these things coming up, about the subcommittees and about the updates on conferences. How about I just put out some talking points to the group and have Wendy post them on the website for the public, and have the chairs of those subcommittees provide their updates in writing. And we'll do that the same way. And if someone has questions about them, they can reach out to me and I can try to provide those answers publicly before our next meeting. How's that sound?
That sounds great to me. And also, I would just like to say real quick that I was going to make some appointments down in action item number 15. Some appointments to some of the subcommittees. So I was going to appoint Deanna Gay, who's been attending our meetings, as to the transition work group as chair. And I was going to appoint Julie Weissman Steinbach, who also had to leave, to the legislative subcommittee as chair. So just so everybody's aware that I'm making those appointments. And then everything else, Dawn, your suggestion is great. Thank you so much. So what I would like, go
Mary
ahead.
has her hand up. Mary, did you have a question? Mary, did you have a question?
Yes, briefly, during our vote, it occurred to me that the agencies requesting the funding voted. I can't remember, but I think with Robert's Rules of Order, if it's your own agency getting the funding, you have to abstain. Does somebody know that regulation?
Yes, actually, you're right, Mary. This is Dawn Lyons for the record. So would Dee Dee and Mary, would you both like to abstain from your, or change your votes to abstain at this point?
Yes, I'm sorry.
Yes, thank you.
Thank you, Mary, for that correction. I appreciate that. Did not catch that myself. Just trying to quickly get through this. So so we're gonna go ahead. I want to move into public comment real fast so that we can end on time. Because Cart has to leave, the interpreters also need to leave at the hour. So let's move into public comment, please. Is there any public comment?
This is Brian Hilbert for the record. And I just wanted to say that, you know, there are a lot of impassioned words and opinions and feelings expressed today. And one of the great challenges that you have as a SILC and centers and an IL network is that we will never properly be able to do the work that we need to do to serve citizens of Nevada with disabilities until the services we provide and the services that you provide and the issues that you work daily to address are seen as an important matter of public policy by elected decision makers. And so I think one of the reasons that people become so impassioned and frustrated by many things is there's not a big enough pie to go around. And the truth is that if ACL doubled the allocation of money, it still wouldn't be enough to meet the needs of the citizens of our state. So I think if I could just say, as somebody who has some experience with these things, as an outsider looking in, remember that you have the responsibility, the privilege, and the challenge to work together, SILC, centers, and DSU, and to always make sure that your comments and actions and attitudes are furthering that long-term cooperative relationship. But more importantly, take your feelings and your passion today and use it as fuel to get organized and to advocate and with legislators and others, so that we can start building sustainable funding models for the 4 core services and all of the other work that must be done in Nevada.
Thank you, Brian. Is there any other public comment?
Laura has her hand up.
Dora, go ahead.
Hi, good afternoon, Madam Chair, Ace, and Vice Chair, and the rest of the SILC. I'm sorry, I'm in a noisy area. I can't help it. Really quick, just so you all know, RTC Washoe is doing a survey for public transportation, and this will negatively impact people with disability if they move on to FlexRide. FlexRide is a curb-to-curb services, not a door-to-door service like paratransit. So I encourage you all to go to RTC Washoe, those who are living in Sparks and Washoe and Carson City area, because there is the Carson City Connect, and do that survey and put in the other with you guys' comment. I also want to praise and thank Ace and Didi for their earlier comment regarding, nothing about us without us, about the extra money. And also their RTC meeting will happen at 10 a.m. April 29th regarding what I just mentioned earlier. And so far, that's all I'm going to say. Thank you so much.
Thank you, Dora. Is there any other public comment?
Linda,
yes, please. Comment? This is Obiama.
Obiama, go ahead.
Yes, this is Obiama. I want to thank you for being here and for making this meeting accessible for deaf and hard of hearing individuals. Also, for someone like myself who utilizes the services, I wanted to make sure that you know they are appreciated. I also wanted to remind you about yesterday, the announcement that went out about the Commission for Deaf and Hard of Hearing having a meeting May 12th. I just wanted that to be a reminder. So hopefully we will see some of you there, and thank you again. That's all. Bye.
Thank you, Obiama. Is there any other public comment?
We have a question in the chat asking Dora for that meeting date.
Hi, it is April 29th at 10 a.m. at 1009 East 9th Street, Building A, and people tell me it's the Red Roof Building, which is the Washoe County Health Department. And just so you all know, wheelchairs users, it does not have the ADA button accessible doors. And that's what I'm also gonna try to let them know. Thank you.
Thank you, Dora, for that information. Is there any other public comment?
Mary has her hand up.
Mary, go ahead.
Just wanted to share with the SILC that we sent the SILC survey to our webmaster to post today, so it should be up pretty quick. Thank you.
Thank you, Mary.
Posted with the Southern Nevada Center for Independent Living.
Thank you, Mary. Appreciate that. Is there any other public comment? Okay, hearing none, seeing none. Appreciate everybody coming and hanging in with us. It was a bit of a tough start at the beginning of the meeting. A lot of us had a lot of feelings, me included, but thank you. And again, like I said, we have a good working relationship with our DSC, and I'm just glad she was here to hear our concerns with this. So thank you all for coming. We will see you in July for our next, oh my gosh, I just closed my iPad down and I don't have the dates. Is it the 13th and 14th of July, Dawn?
Yes, it is 13th and 14th at 1 p.m. each day.
Okay, and the council members look for what Dawn will send you about the rest of the agenda items, and look forward to seeing everybody then. Thank you all very much.
Everybody.